Welcome to Community Health Nursing mini-series. This mini-series have been designed to introduce to you fundamental community public health nursing concepts. Before you begin listening to this mini-series, I recommend that you have your notebook ready and you have your PowerPoint printed and that you're taking notes so you can follow along with this mini-series lesson. By the end of this lesson, the student will describe the goal of public health nursing services, understand community-based nursing practice, describe community-oriented nursing. It is very important to remember that when we talk about public health nursing, we understand that the focus is on how the health of individuals in the public, families, and groups affects the community as a whole. So when we talk about public health nursing, we are talking about focusing on health promotion, disease prevention, and we're also talking about managing factors that affect health in our community. So, what happens when we focus in this manner? It means that we are assessing and monitoring health problems in our communities. We are informing the public and the professionals about the health issues that are present. We are developing and enforcing health protection laws and regulations, and we are implementing and evaluating population based strategies to promote health and prevent diseases. We're also assuring the provisions of essential health services. One important consideration for nurses to make is to understand the difference between community based nursing and community oriented nursing. So, the first thing we're going to do is describe community based nursing. Community based nursing is setting specific. What does that mean? It means that we're thinking of community nursing in terms of where it's based, the setting. Nursing, then, is going to be given to sick people or patients who live and work in the places we're giving nursing care. So we're taking nursing like we understand it and we're giving it to people where they live, where they work, and where they attend school. So community based nurses deal primarily with illness oriented care. They focus on illnesses. So these people can specialize in maternal, infant, child issues in the community. They can be pediatric community based nurses. They can be adult community based nurses. They can be psychiatry community based nurses. Can you think of other examples that nursing can be community based? Community oriented nursing is a different approach than community based nurses. Any nurse, regardless of setting, can be community oriented. Think of this manner as if you're thinking of the community itself as your patient. So health care is going to be provided in terms of the community as a whole. Think about how you're going to diagnose that patient. Think about how you're going to assess the major health issues in that patient, how you're going to do surveillance, how you're going to evaluate, and how you're going to promote that patient. Okay, so community oriented nurses provide health care to promote the quality of life. When we think about community with a community oriented approach, we are going to assess the entire community, not just one individual as shown. So, for example, we're not just going to check the blood pressure of the first person in line, we're going to take the average blood pressures of everybody that's in line and assess whether the community hypertension rates are under control. So, in concept, our assessment approach focuses on the entire globe, entire city, entire country. So we think of community as an aggregate. What is an aggregate in public health? An aggregate is defined as a collection of people who share one or more personal or environmental characteristics, such as the geography or any special interests. So that's how we're going to define an aggregate. In community oriented practice, we isolate a group of people and we intervene for health services for that group. In closing this mini lesson, then, it's important that we have an understanding of what public health nursing is. Please note that public health nursing and community health nursing are terms that sometimes the public will use interchangeably, but public health nursing is a community oriented nursing approach. It is when nursing as we understand it now in public health nursing theory is synthesized together and applied to promote and preserve the health of aggregates. The focus is on aggregate health as a whole. And we look at the community health status, we look at the community resources, and how these are affecting the health of the people. By people, we mean families, individuals, and community groups and subsets. The goal of public health nursing is to prevent disease and disability and promote and protect the health of the aggregate.